Welcome dear students, I am Dr. Pratyusha. In this video, let us learn about two special types of otitis media that are caused by specific organisms, and they are syphilitic otitis media and diphtheritic otitis media. First, let us learn syphilitic type. Now, syphilitic otitis media is quite rare actually. But if it occurs, it can occur via the eustachian tube. Now, the spirochetes could be present in the nose or in the nasopharynx, and they travel via the eustachian tube and invade the middle ear cleft. So, the infection is via eustachian tube. From nose or nasopharynx. Sometimes the infection could also be blood-borne. The problem with syphilis is it affects the sensory end organs of the inner ear, and even the nerves are affected, and this will lead to sensory neural type of hearing loss. If you look at the pathophysiology of syphilitic otitis media, the sensory end organs of inner ear are affected. Sensory end organs of inner ear, and also the nerves are affected. And they are gradually invaded. It's a slow and insidious process, but it leads to profound hearing loss. And what type of hearing loss it is? It is sensory neural type of hearing loss. Not just profound hearing loss, there is also tinnitus and vertigo. The inner ear is affected because of syphilis. We also find bone necrosis. Bone necrosis and sequestrum formation will occur as complications of syphilitic otitis media. If we look at the clinical features, because of bone necrosis and sequestrum, the discharge is fetid. Fetid ear discharge, profound hearing loss. It's also possible that there could be secondary pyogenic infections, and if secondary pyogenic infections occur, the features will be those of the common CSOM that we see. And for definitive diagnosis of syphilitic otitis media, specific treponemal tests have to be done. Specific treponemal tests. What are specific treponemal tests? Treponemal pallidum immobilization test. Immobilization test is one. Fluorescent treponemal antibody absorption test. Fluorescent repeat. Fluorescent treponemal antibody absorption test. These two are specific tests. VDRL and reactive plasma reagent RPR tests are only used for prognosis. They are not specific. For diagnosis, we need to do TPI or FDA-ABS. And treatment of the disease consists of giving anti-syphilitic therapy plus local care of the ear has to be taken. If at all there are any secondary pyogenic infections, they have to be treated. Now, to remove the sequestra, sometimes surgery could be required. So, this is about syphilitic otitis media. It's a simple thing to learn about in ENT. Infection could reach mostly via the Infection could reach mostly via the eustachian tube. Sometimes it could be bloodborne also. What you see is that the most important feature of syphilis is it affects the inner ear, the sensory end organs and the nerves of inner ear, and this leads to sensory neural type of hearing loss, which is very profound. Along with hearing loss, tinnitus and vertigo could also be present. Along with hearing loss, tinnitus and vertigo could also be present, and bone necrosis and sequestrum are sometimes seen. If you look at the clinical features, there is fetid ear discharge plus profound hearing loss, and diagnosis is by specific treponemal tests, and treatment consists of anti-syphilitic therapy. Now let us look at another specific type of otitis media, and that is diphtheritic otitis media. Caused by Corynebacterium diphtheria. Now, diphtheritic otitis media occurs very rarely. The disease is usually limited to the pharynx, but if it occurs, the complications are very frequent and common. That is the problem with diphtheritic otitis media. It may accompany the diphtheric croup and nasopharyngitis. Along with that only, this usually occurs. It is the complications that are important and problematic. What could be the complications? A diphtheric membrane could be formed in the middle ear, just like how it is formed in the pharynx. A diphtheric membrane could be seen in the middle ear. Destruction of tympanic membrane can occur. Destruction of tympanic membrane and ossicles, middle ear ossicles. Infection of the contiguous structures. Entire middle ear cleft could be infected. There could be necrosis of bones. What are the bones that are usually involved? Mastoid and temporal bone. These two bones could show necrosis. Now, treatment of diphtheritic otitis media is by giving antibiotics, steroids and anti-diphtheria serum. It's usually conservatively managed. But for the necrosis of bones, if at all that occurs, surgical treatment is required to remove the necrotic tissue and debris. So, treatment consists of antibiotics, steroids, anti-diphtheria toxin plus surgical intervention to remove the necrotic tissue and debris. So this is all about diphtheritic otitis media. Although it occurs rarely, if it occurs, the complications are very frequent and important. And treatment is the same as diphtheric pharyngitis. We have to give antibiotics, steroids and anti-diphtheria toxin plus surgical intervention is required to remove the necrotic tissue. So this is about syphilitic otitis media and diphtheritic otitis media, which are two special types, just like tubercular otitis media. Thank you very much.